Hello everyone, this is the Ministry of Health's Week in Review. Here is what we've been up to. At the opening of a joint regional health security and regional coordinating mechanism for health security workshop held on July 29th, Honorable Minister Dr. Frank Anthony made a call to action on behalf of the government of Guyana, urging global leaders and regional partners to unite in building robust, future-ready health systems through visionary action, strategic investment, and strong partnerships. The workshop aimed to strengthen regional capacities to protect public health and respond to infectious diseases, pandemics, and other health threats. The following day, the minister participated in the Unleashed Ability Summit focused on empowering people with disabilities through innovative mental health initiatives and inclusive rehabilitation for sustainable change. In his remarks, he underscored the importance of holistic healthcare, emphasizing that mental health must be addressed as a core component of rehabilitation and inclusion. He highlighted the Ministry of Health's ongoing efforts to improve access to psychosocial services, community-based rehabilitation, and equitable healthcare for all. In a transformative move for healthcare in Guyana, Region 5 marked a historic milestone with the official commissioning of the Bat Regional Hospital, the first state-of-the-art medical facility of its kind in the region. The hospital, valued at $6.6 billion, was formally opened by His Excellency Dr. Mohamed Irfan Ali, President of the Cooperative Republic of Guyana, during a significant ceremony that underscored the government's commitment to strengthening healthcare delivery and accessibility across all regions. The Minister of Health, during his remarks at the ceremony, hailed the project as a model for future regional health institutions and praised the team of local and international partners involved in the successful completion of the facility.
This transformation is led by His Excellency Dr. Mohamed Irfan Ali, the President of our country, whose vision and dedication has made progress possible. Mr. President, we have seen a transformation of our country led by you over the last couple of years. And your leadership reminds us that real development is not measured only in economic growth, but in health, in safety, and in dignity of our people. The investments you have championed in the area of health, in digital health, in modern hospitals, in new health centers, in public-private partnerships, have all been preparing Guyana to meet its needs now and for the future. And you are positioning our country as the healthcare leader of the Caribbean and beyond. Today, it is yet another big dream being realized.
On Thursday, July 31st, Dr. Anthony joined the staff of the ministry in celebrating Emancipation 2025 with vibrant displays of culture, heritage, and unity. Staff showcased traditional African wear and cuisine in honor of our ancestors, resilience, and the richness of our heritage. On August 4th, the Ministry of Health, in collaboration with the Pan American Health Organization, officially launched the 2025 Lymphatic Filariasis Mass Drug Administration National Training, an initiative aimed to eliminate lymphatic filariasis as a public health threat in Guyana by equipping healthcare professionals with the knowledge and skills required for effective implementation of the MDA-IDA protocol. During the opening ceremony, the health minister shared encouraging updates on Guyana's progress. He noted that lymphatic filariasis has already been eliminated in 8 out of 10 regions. However, he highlighted that certain communities in regions 3 and 4 remain challenging in the fight against the disease.
And that is why we're going back this year to ensure that we cover these areas thoroughly. And I think if we do that, we are going to be able to then say, sometime next year, the year after, that we have eliminated from all the regions in Guyana.
In its ongoing commitment to strengthen healthcare delivery through enhanced human resource capacity, the Ministry of Health on Tuesday proudly graduated 128 students from its Health Sciences Division. The newly trained patient care assistants, drawn from Regions 3 and 4, successfully completed an intensive 4-month training program and are now equipped to provide direct hands-on care to patients under the supervision of nursing assistants or registered nurses. Their addition to the healthcare workforce is expected to improve frontline service delivery and support the ministry's goal of building a resilient, patient-centered health system. Delivering the keynote address, the minister congratulated the graduates and commended their efforts to serving in one of the most noble and impactful professions. He reminded them of the values and responsibilities that come with being part of the healthcare sector. On Wednesday, Minister Anthony welcomed a new cohort of Peace Corps volunteers to Guyana. This batch marks the 36th group and the 4th group of Peace Corps response volunteers serving in the country. The minister praised the long-standing partnership between the government of Guyana and the U.S. government, particularly through Peace Corps, USAID, and PEPFAR. He cited multiple successes, including the establishment of the National Public Health Reference Lab through PEPFAR. This brings us to the end of the Week in Review. Thank you for joining us. Remember to visit your nearest health center to uplift your health vouchers. Individuals eligible for the newborn cash grant are advised that the Ministry of Health will handle the printing and distribution of these grants, which will be delivered to respective regional health officers.